India is being shaken by a wave of new COVID-19 infections like nowhere else right now. The country has recorded the world's highest daily tally ever, with nearly 315,000 cases in the last 24 hours. This latest wave has overwhelmed the healthcare system. Some hospitals in the capital, Delhi, have already run out of the oxygen needed to keep people alive.
Families of the sick wait helplessly outside of the hospital. India is facing an acute oxygen shortage as COVID-19 infections skyrocket. 22 patients died at a hospital in Maharashtra state after a leak cut off their oxygen supply. This woman's mother was one of them. She had been here for 5 days and had recovered. There was no oxygen. She died in agony. She had trouble breathing. She died. Everyone in the ward died. Hospitals in India are flooded, with some warning they will run out of oxygen within hours.
Demand for oxygen has gone up significantly. We have at least 350 COVID patients, and all of them require oxygen. And because of which the supplies that are coming in, which are very irregular and uncertain, there is a lot of tension in the system.
Oxygen supplies are being rushed across India after Delhi's High Court ordered tanks to be diverted from factories to hospitals. Medicine supplies are also running low in India's largest city of Mumbai.
I'm feeling really helpless because being a pharmacist, my duty is to fulfill the demands of the customer. When I'm not able to fulfill the demands, so there's no use of coming to the pharmacy. I'm feeling really helpless. People are trying, they're asking for medication, and I'm saying no, no, and no.
Cases of the coronavirus have surged after millions flocked to religious festivals in recent weeks. Elections and political rallies also attracted large crowds, giving the virus free rein to rampage through the population.
I'm joined now by DW correspondent Nimisha Jaiswalow in Delhi. Nimisha, we're hearing about this desperate shortage of oxygen and hospital beds. How bad is the situation at the moment?
Well, Rebecca, the situation clearly is dire. There's a desperate scramble for medical care. Medical infrastructure across the country is under severe stress, especially in hotspots like New Delhi and Mumbai. Once again today, we are seeing people scrambling, crowding around hospitals which are totally full, trying to get treatment, trying to get oxygen, trying to get beds. There are shocking instances of deaths being reported as hospitals run out of oxygen. And the times are so desperate that social media in India is flooded with requests for oxygen, for beds, for medication. And this truly indicates just how difficult it is for the governments on every level to cope with this crisis, that people are actually turning to Instagram and Twitter as their last resort.
Yeah, certainly an alarming situation. What about the vaccine rollout? Is there a chance that immunisations could improve things soon?
Well, the vaccine rollout in India has been sluggish. India is lagging behind its original targets. Of course, because of the massive population here, posting doses given out every day of between 2 to 4 million does make the vaccine drive look impressive, but still it has not even reached 10% of the population with at least one dose. The Indian government has now announced an expansion of the drive to everybody above the age of 18 from the 1st of May. This has, of course, been hailed as an important step. However, there are concerns that now that manufacturers are allowed to put vaccines on the open market, this could push up prices and take them out of the reach of India's poor.
What else then are authorities doing to try and combat this explosion in infections?
Well, Rebecca, the authorities are actually making decisions on a state-by-state level. We still don't have a declaration on the national level. The Prime Minister did come out appealing to people to take precautions to avoid a national lockdown, but authorities in the hardest hit states like Delhi and Maharashtra have imposed different versions of lockdowns and shutdowns, saying they need this time to ramp up healthcare infrastructure. But it does truly look like a day-upon-day firefight, and there might be much more stringent action needed because these curfews are not showing an impact on numbers, at least so far.
Mammoth task ahead. DW correspondent Nimisha Jaiswalow in Delhi. Thanks very much.